Now we are waiting for the panelist comments. We are delighted to hear from Professor Sarmad.
السلام عليكم.
السلام ورحمة الله وبركاته.
وعليكم السلام أستاذ.
أنا أحب أهنيكم على الشيء اللي تعملوه. And I want to congratulate you for this success which you really deserve. It's very hard work because I used to try to do things in Iraq and I know how difficult it is. But with time, you will we see it will be much easier with time. You only need to persevere to continue what you are doing. People will realize with time how much benefit you are doing. There are very few procedures in medicine will give a result of the benefit the thrombectomy is giving. It's really fantastic. Number needed to treat is 1 in 2 or 1 in 3, which is fantastic. Ask any other specialty if they have any procedure that gives such a high benefit to patients. And I think you are in the right lane, and you will be much better with time. Time is experience. And the more you experience you have, the better the results. And this will reflect on your students. You are going to create a new and a lot of people who will do this procedure in the future and will be good at it. So I would like to congratulate you and thank you for asking me to participate in this meeting.
Thank you a lot, sir. We are so delighted to hearing from you. The word is yours, Dr. Mutaz.
شكرا جزيلا للزملاء الحضور والمشاركين، وشكرا جزيلا لأستاذنا الكبير أستاذ سرمد الفهد على حضوره وعلى تشجيعه، وإن شاء الله هذه راح تكون فاتحة خير لفعاليات أخرى أكثر. حقيقة إحنا عندنا الكثير من المشاكل تواجهنا فيما يخص علاج الجلطة الدماغية. واحدة من أهمها أتصور يعني يمكن هو الأندر استيميشن اوف ستروك دايجنوسيس. هذه واحدة من المشاكل الكبيرة. واثنين أنه ستيل يعني أغلب مو بس المرضى، حتى أغلب الزملاء الآخرين هم يعتقدون أنه case of stroke is hopeless regarding treatment. حقيقة لا، هذا المفهوم لازم احنا كنيورولوجيست نحاول نعكسه. We can do a lot for patients with stroke. دكتور مصطفى، دكتور علي، شكرا جزيلا لجهودكم الكبيرة في إنشاء هاي النتورك، وإن شاء الله نبقى مستمرين بها ونوسعها ونتواصل أكثر وأكثر. بركة الجهود مرة ثانية. أشكركم جميعا.
السلام عليكم.
شكرا جزيلا. Now
we are started.
Go on.
Sorry, the voice is clear. أنا دكتور علي عبد الكريم، نيورولوجيست. أشكر أولا أشكر الله عز وجل على هذه الفترة الزمنية بأن يجعلنا تحت الأساتذة الخبرة الهيمة التي تعتبر من العناصر المهمة لدعم كل مشروع جديد لبناء مستقبل جيد لخدمة الناس. الآن نبدأ بالأسئلة التي لعلها لابد توجد لها أجوبة تكون لدى الناس الكثير من يسأل. العفو دكتور تميم, we have one question for you, please. The voice is here.
Dr. Tamim, are you with us?
Sorry.
تفضل دكتور علي اسال.
Now we have the second question with Dr. Sarmad.
Yes, I'm hearing.
Dr. Sarmad, عفوا تسمعنا?
Yes, I am
Okay.
hearing.
Regarding to the okay, تمام. Regarding to the RTPA to the patient with acute ischemic stroke, we have a question. How is the situation of stroke awareness and stroke therapy awareness in Kurdistan region? We mean about the educational level in the people. Can explain to us, please?
Yes, okay. Yes, about actually the education is very low regarding the signs and symptoms of stroke and regarding the arrival of patients to emergency hospitals and emergency room in the hospitals, especially in Rizgari Hospital, where we have RTPA and a neurology department. Calling is available 24-hourly there. So that's why over years we are trying to give RTPA, but there are little number of patients who are arriving in the time. But we are trying our best to catch those people who arrive early and to administer the RTPA at the time. And our senior house officers are well educated about dealing with acute stroke patients and with the liaison of the with the seniors. They try to give the RTPA for the patients who are coming in less than 4.5 hours. Although the patients who received in less than 1 hour, 90 minutes or 2 hours got more benefit, but we give RTPA for if the stroke onset is before 4.5 hours.
Thank you so much. We have we understand from this point the education level is still need more practice and more exercise to educate the people about this stuff, how to deal with it at home, at supermarket, at street, at any place, and how can reach to the specific point. Also, we have a trouble with the trouble T. The first of all is time and the trouble, and also the teamwork. How can advise? Sorry, about the RTPA. So patients receive a lot of patients receive RTPA. How many patients receive within 1 hour?
We have just one patient received in less than 90 minutes. We have no less than 1 hour actually. Just one patient received 90 minutes, less than 90 minutes, and about like 3-4 patients received less than 2 hours. But most of the patients received less than 3 hours.
Sorry, about the facing problem. It is occurring this patient regarding to the patient with stroke and seizure. As we reading, as we know, there is some point about stroke with seizure.
Yes.
We know there is thought paralysis. This is facing problem. Is a current patient with RTPA during this research?
Yes. So we have stroke mimics. One of the stroke mimics is the seizure and the paralysis that the paralysis that is combined or accompanied the seizure. This is actually one of the difficulties of giving RTPA in worldwide also. So according to our experience, if we have patients with age like more than 50 or 60 years, with risk factors of hypertension and diabetes, even if they are presented with seizures and paralysis, so we give RTPA if they are eligible for the RTPA. In order to
The last question, sorry, Dr. Sarmad.
okay.
Last question, sorry. If patient receive bolus, the RTPA, and get well, completely normal, continue to maintenance or not?
So in our experience, we didn't get patients who become completely normal after bolus dose, actually. So we continued with the infusion. So we all patients are received the full dose within 1 hour in the whether in the emergency room or in the ICU, and then we followed up them after 1 hour, actually after half hour, then after 1 hour. We have no experience with such patients actually.
شكرا جزيلا دكتور
Thank
سرور.
you.
والآن مع دكتورة براء لتكملة بعض الأسئلة. دكتورة براء.
Assalamu alaikum. I'm Dr. Bara, a junior doctor in my second year and have an interest in neurology. I'm here to raise questions to our doctors. I have a question from Dr. Tamim to Dr. Sarood. Is there any stroke unit in Kurdistan or Erbil or the question you are in, Dr. Sarood?
Yes. So we started dealing with the stroke patients. We have no yet a dedicated stroke center, but we have started to deal with the stroke patients in neurology department since 2010. We admitted patients in the neurology ward, and then in 2018 we started to give RTPA in the emergency room and the ICU of the hospital, and then refer the patients to the neurological ward after 24 hours if there are no considering complications. We are working on establishing a stroke unit in the Rizgari Teaching Hospital, and together with the cath lab in order to be able to have a stroke center with a cath lab in our hospital.